Welcome to our channel. Today, we will explore deeply about common liver disease. It is fatty liver. Let's break down the explanation of fatty liver disease, its underlying mechanisms, and how the ketogenic keto diet can be related to its management, and especially how to get rid of the fatty liver by adjusting our food intake. Let's understand about fatty liver disease. Fatty liver disease is also known as hepatic steatosis. Fatty liver disease occurs in an abnormal accumulation of fat within liver cells. This condition can be broadly classified into two main types. First, non-alcoholic fatty liver disease, or NAFLD. This condition is characterized by excess fat accumulation in the liver in individuals who consume little to no alcohol. NAFLD encompasses a spectrum of liver conditions ranging from simple fatty liver to non-alcoholic steatohepatitis, which involves inflammation and liver damage. Second, alcoholic fatty liver disease. As the name suggests, this type of fatty liver disease occurs in individuals who consume excessive amounts of alcohol. Chronic alcohol consumption leads to the deposition of fat in the liver, which can progress to more severe liver damage, such as alcoholic hepatitis and cirrhosis. These are signs of fatty liver disease you should aware too. Number 1. It's fatigue. Chronic fatigue, or feeling persistently tired, even after adequate rest, can be a common symptom of fatty liver disease. The liver plays a crucial role in energy metabolism and detoxification. When the liver is affected by fatty infiltration, its ability to efficiently metabolize nutrients and detoxify the body may be compromised, leading to feelings of fatigue. Number 2. It's abdominal discomfort. Pain or discomfort in the upper right abdomen, where the liver is located, may occur due to liver enlargement or inflammation. This discomfort can range from a dull ache to sharp pain and may worsen after consuming fatty or heavy meals. In some cases, the discomfort may radiate to the back or shoulder. Number 3. It's jaundice. Jaundice is characterized by the yellowing of the skin and eyes. Jaundice occurs when bilirubin, a waste product produced by the liver, builds up in the body. In fatty liver disease, liver damage or dysfunction can impair the liver's ability to process bilirubin, leading to its accumulation in the bloodstream and subsequent yellowing of the skin and eyes. Number 4. It's unexplained weight loss. Rapid or unexplained weight loss may occur in individuals with advanced fatty liver disease, particularly in cases of non-alcoholic steatohepatitis or advanced fibrosis. Weight loss may occur despite maintaining regular eating habits or even an increased appetite. This weight loss may be attributed to decreased nutrient absorption, increased metabolic demand due to liver inflammation, or metabolic changes associated with liver dysfunction. Number 5. It's swelling in the abdomen. The accumulation of fluid in the abdominal cavity can occur as fatty liver disease progresses. It may cause abdominal swelling or distension, discomfort, and difficulty breathing. It typically develops in advanced stages of liver disease and is a sign of significant liver dysfunction and portal hypertension. Number 6. It's enlarged liver. Liver enlargement may be detected during a physical examination by a healthcare provider. Liver enlargement can occur due to inflammation, fatty infiltration, or fibrosis of the liver. Enlargement of the liver may cause discomfort or a feeling of fullness in the upper right abdomen. Number 7. It's dark urine. Dark urine, often described as amber, brown, or tea-colored, may indicate liver dysfunction or damage. The dark coloration is due to the presence of bilirubin in the urine, which occurs when the liver is unable to process bilirubin effectively. Dark urine may be accompanied by other symptoms of liver dysfunction, such as jaundice or abdominal discomfort. Number 8. It's pale stools. Light-colored or pale stools, often described as clay-colored, may occur when there is a decrease in the production or flow of bile from the liver. Bile gives stools their characteristic brown color, and a reduction in bile flow can result in pale or clay-colored stools. This symptom may indicate obstruction or dysfunction of the bile ducts or liver. Number 9. It's loss of appetite. Decreased appetite or feelings of fullness after eating small amounts of food may occur in individuals with fatty liver disease. This loss of appetite may be related to nausea, abdominal discomfort, or changes in metabolism associated with liver dysfunction. In some cases, individuals may also experience a change in taste perception or aversion to certain foods. Number 10. It's nausea and vomiting. Nausea, vomiting, and digestive discomfort may occur as liver function becomes compromised in fatty liver disease. These symptoms may be triggered by inflammation, accumulation of toxins in the bloodstream, or disturbances in the digestive process. Persistent or severe nausea and vomiting should be evaluated by a healthcare professional. Let's continue to explore why fatty liver occurs. The development of fatty liver disease is influenced by various factors. These are metabolic and lifestyle factors of fatty liver disease. Number 1. It's insulin resistance. A condition in which cells become less responsive to the effects of insulin plays a significant role in the pathogenesis of fatty liver disease. When cells are resistant to insulin, the body compensates by producing more insulin, which promotes the synthesis of fatty acids in the liver. Number 2. It's excess dietary carbohydrates. Diets high in refined carbohydrates and sugars can contribute to fatty liver disease by increasing blood glucose and insulin levels. Excess glucose not used for immediate energy needs is converted into fatty acids in the liver through a process called de novo lipogenesis. Number 3. It's dyslipidemia. Abnormal lipid metabolism, characterized by elevated levels of triglycerides and low-density lipoproteins (LDL) cholesterol, can lead to the accumulation of fats in the liver. Number 4. It's obesity. Excess body weight, particularly visceral fat, is strongly associated with fatty liver disease. Obesity promotes insulin resistance and inflammation, both of which contribute to liver fat accumulation. Metabolic problem is behind problem of fatty liver disease. This is what happens to your metabolic condition when you have fatty liver disease. In individuals with fatty liver disease, the liver's ability to metabolize and process fats is impaired. Normally, the liver plays a crucial role in lipid metabolism, including the uptake, synthesis, oxidation, and export of fatty acids. However, in fatty liver disease, there is an imbalance between lipid uptake, synthesis, and disposal, leading to the accumulation of fat within liver cells. These are the actions you should take immediately to improve your liver health. Number 1. It's promotion of ketosis. By drastically reducing carbohydrate intake and increasing fat consumption, the ketogenic diet induces a metabolic state known as ketosis. In ketosis, the body primarily relies on fat for energy, including stored fat within the liver, thereby reducing liver fat content. Number 2. It's improved insulin sensitivity. The ketogenic diet has been shown to improve insulin sensitivity, which helps mitigate insulin resistance, a key driver of fatty liver disease. By reducing carbohydrate intake and stabilizing blood sugar levels, the keto diet may alleviate the metabolic dysregulation associated with fatty liver disease. Number 3. It's reduction in hepatic lipogenesis. The ketogenic diet suppresses lipogenesis process by which the liver converts excess carbohydrates into fatty acids. By limiting the availability of substrates for fat synthesis, the keto diet can help prevent further accumulation of fat in the liver. Number 4. It's weight loss and reduced inflammation. The ketogenic diet often leads to significant weight loss, particularly visceral fat, which is strongly linked to fatty liver disease. Additionally, ketones produced during ketosis have anti-inflammatory properties that may help reduce liver inflammation. Next is superfoods, which can eliminate fat and improve our fatty liver condition. These are recommended superfoods for you to combat the fatty liver disease. Number 1. Leafy greens such as spinach, kale, and Swiss chard are rich in antioxidants, vitamins, and minerals that help support liver function and protect against oxidative stress. They are also high in fiber, which aids in digestion and helps remove toxins from the body. Number 2. Cruciferous vegetables like broccoli, Brussels sprouts, and cauliflower contain compounds called glucosinolates, which support liver detoxification pathways. They also provide sulfur compounds that help the liver eliminate toxins and metabolize fats efficiently. Number 3. Low-sugar berries such as blackberries are packed with antioxidants like anthocyanins and vitamin C, which help reduce inflammation and oxidative stress in the liver. They also contain fiber, which supports digestion and helps regulate blood sugar levels. Number 4. Fatty fish like salmon, mackerel, and sardines are rich in omega-3 fatty acids, which have anti-inflammatory properties and may help reduce liver fat accumulation. Omega-3 also support heart health and overall well-being. Number 5. Nuts and seeds, including walnuts, almonds, and flax seeds, are excellent sources of healthy fats, protein, and fiber. They also contain antioxidants like vitamin E and selenium, which help protect liver cells from damage and support detoxification processes. Number 6. Turmeric contains a compound called curcumin, which has powerful anti-inflammatory and antioxidant properties. Consuming turmeric or its active component curcumin may help reduce inflammation in the liver and improve liver function. Number 7. Green tea is rich in catechins, antioxidants that have been shown to protect liver cells from damage and reduce inflammation. Drinking green tea regularly may help improve liver health and reduce the risk of fatty liver disease. Number 8. Avocado is a nutrient-dense superfood that provides healthy monounsaturated fats, fiber, vitamins, and minerals. It also contains compounds that support liver health, including glutathione, a powerful antioxidant involved in detoxification processes. Number 9. Garlic contains sulfur compounds that support liver detoxification and help reduce inflammation. Adding garlic to your meals may help improve liver function and protect against fatty liver disease. Number 10. Beets are rich in antioxidants, vitamins, and minerals that support liver health and promote detoxification. They also contain betaine, a compound that helps reduce fatty deposits in the liver and may protect against liver damage. In summary, fatty liver disease is a complex condition characterized by the abnormal accumulation of fat in the liver, driven by many factors. The ketogenic diet offers a multifaceted approach to managing fatty liver disease. However, it's important to consulting with a healthcare professional and watch your liver condition periodically. Thanks for watching. See you in the next video.